haven't seen that yet.
Yeah, it's been a while.
I appreciate that. Boy, I'll tell you. Okay. Oh, we're hot. I believe that our chairperson will be here momentarily, but it's 10:01, so we'll go ahead and get this started. They're coming in from everywhere. All right, call this meeting to order. Roll call.
David Hooton, present.
Rick Warren, present.
Miles Davidson for District 3, Commissioner Kevin Kelby.
Michael Taylor for County Commissioner Brian Mon.
Joe Blau, representing District 1 for Kerry Bloomer.
Butch Freeman, County Treasurer.
Tommy Johnson, 3rd, Oklahoma County Sheriff.
Mike Morrison for Assessor Larry Stein.
And if the commissioners don't mind, we won't rise, but we will let them come on up here. I'll rise. Hi, Commissioner. Thank you. Hi, Commissioner. All right, we literally just went through roll call.
You want to do it over?
No.
You want to do the pledge?
Sure. Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. That was a good pledge. That was one of our best ones.
Is there, thank you, a motion to approve the minutes of July 15th?
Motion.
Second.
All in favor, say aye.
Aye.
Is there any individual consideration on the consent docket? If not, is there a motion?
Motion.
Second.
All in favor, say aye.
Aye.
Danny?
Good morning.
Good morning, Danny.
All right, there is a PowerPoint attached to that agenda item if you want to pull that up.
Just a second, we're catching up
All right.
because that was lightning speed for the last few things.
Thank you. All right. First slide, this is the general fund budgets by department. I have highlighted the amount that we have in reserve, $1,158,000. There's one item on this agenda, item 42. MIS is requesting $103,000, so that would come off of this number. If it's approved, that would leave a balance of $1,054,000. We are going through the September supplement process, so the next month we will have an updated figure for this board and a recommendation from BET, but I would assume that some of that money will be put in reserve, so we'll come back to this board next month with some recommendations. Still looking at general fund on page 4. We've only got one month into the fiscal year. We've collected about 2%. The cash balance in general fund is a little less than $10 million. This is the time of the year that the treasurer's office has to borrow from other funds because the cash balance gets so low. So a typical month in salary and benefits alone, we pay out about $4.2 million. So you can see we get through that cash balance pretty quick the first couple months. A couple slides over is employee benefits fund, slide number 6. again, 1 month, just taking an estimate based on just 1 month's amount of data. You just take an average, shows it will come up about $1 million short, but again, that's 1 month's worth of claims to consider. So that should even out as we move forward into the fiscal year. One other slide is the Capital Projects Fund. I've highlighted the unallocated funds amount that's currently available, $67,589. There's an item on here, number 43, requesting that $64,000 of that be moved to a line item for the 11th floor courthouse. So that's where that money will come from. That's all I have.
Motion to receive the report.
Second.
All in favor, say aye.
Aye.
Mr. Cody.
Good morning. BET met this a week ago. We don't have any items added to necessarily watch. We do have an item added as a recommendation. It is item number 42 on your agenda today. Mr. Lambert addressed it just briefly in his presentation. It's a request from IT to fund $103,479.40. So when you guys get to that item, I'll be happy to address that a little more in depth.
Any questions?
Motion to receive the report.
Second.
All in favor, say aye.
Thank you, Cody.
Mr. Wilkerson.
Good morning. I placed an attachment on the agenda. I'm just going to go over that just real briefly. Through the 16th of this month compared to last fiscal year, our inpatient claims are 10% lower, outpatients 3% above, and professional services are 5% above where we were. And it's just been a month and a half, so there's not much data to compare it to now. The really concerning thing I see, though, is since about July 15th, we've had 5 members inpatient with COVID. Only 2 members are still inpatient, 1 very seriously, been flown out of state. So we're watching that situation. The good news is we still have stop-loss insurance for that purpose, and hopefully we'll have some CARES reimbursements or other monies to reimburse us for those COVID claims.
Did you say 1 had been flown out of state?
Yes, sir.
No
Really?
events left in Oklahoma, so they had to be,
So-
my
Oh, my
understanding
gosh.
was, taken to Colorado.
Oh, my gosh.
Correct. And then on that attachment too, I just briefly mentioned our annual health screening. Currently, we exclude retirees age 65 and over and their spouses because they have Medicare primary. We provide a Medicare supplement, so they haven't been included in the screenings. They don't get all those tests through Medicare, so we're just administratively asking that we add those to our health screening to allow them to screen because they're still on our prescription plan and some other things.
Okay. Questions of John?
Motion to receive.
Is there a sec- All right, all in favor, say aye. Aye.
Thank you.
Whoever seconded needs to hit your button.
I did, I'm sorry.
Okay, item 37 is just to kind of bring us up to what Congress has done, and this is formalizing just so that it's been addressed formally by this board, which is another 80 hours could be used in the event someone is quarantined for COVID purposes. Is there any questions about this?
I wanted to thank you for doing this because it's really, really important that we allow our staff to be taken care of without using up their own time when they're being quarantined and stuff.
We don't have any idea as far as the financial impact on this, since we can't project how many would be taking advantage of it, right?
Nor am I absolutely certain that this hasn't already been invoked by various different departments because they were aware of their own research that this had been done by Congress. And so I just wanted to bring this here and formally, we may have already had bookkeeping occur from various departments that were utilizing this. So tracking some of it may already be out the door.
Okay.
Well, we can do paid administrative leave as well, right? I mean, isn't that the same as?
That's been also done in some cases, from my understanding. So that's why I just wanted to bring this here and try to have it as uniform as possible.
I agree with that. Okay. I agree with that. And incidentally, I think these 3 additions to it are really significant additions. Where you obtain, you get to use your paid sick leave to get the shot and then to recover from it. And then you also get to use your sick leave to await the results of the test after you've been exposed. And I have no objection to those because I think those are 3 very important ones that apparently were not part of the original.
I'll make a motion.
I'll make second it.
Any other discussion? All in favor, say aye.
Aye.
Mr. Wilkerson.
Item 38 is an amendment to the health plan. Currently, hearing coverage, hearing testing, hearing aids are only covered for dependent children. Just like to update our coverage to cover that for adults as well. That's a gap in our coverage. If you approve this, then that will go into effect, and we'll try to seek some lower pricing through evolution as well. But currently, there's a gap. Adults don't have hearing coverage or hearing aid coverage.
I'll make a motion.
And it's my understanding that this also includes cochlear implants?
Correct.
Which is, I have several friends with cochlear implants, and they're very expensive, and when you need them, you need them. So I'm really glad that we're doing this. Thank you.
Second.
Thank you.
Well, the motion hadn't been made yet. I didn't get made, so Tommy,
Motion.
Now it's been seconded.
it's been seconded.
Okay, all in favor, say aye.
Aye.
Thank you.
Thank you, John.
Thank you very much for getting this some 12 months after I got my hearing aids. They were very
Can he
expensive.
be paid back?
Can I be, no,
Do what?
Okay. This is an item from the election board to move 5,000, or not to exceed 5,000 from M&O to capital for the 90% threshold.
Motion to approve.
second.
All in favor, say aye.
Aye.
And also with juvenile, not to exceed 6487 from operations to capital.
Motion.
Second.
This is for butterfly valves that were damaged during the pipe freeze. All in favor, say aye.
Aye.
And then also from juvenile, from another fund, not to exceed 3493 from operations to capital.
Motion.
Jamie, is this just one side is from your detention budget and one side is from your bureau budget? Okay.
I motioned.
Okay, all in favor, say aye.
Aye.
42, not to exceed $103,479.40 from general fund to information and technology, with $67,600 to go into salaries and $35,879.40 into benefits. And this is the use for a transfer to hire a full-time web designer. And Cody, you want to, I know the background on it, but you can go ahead if you want to.
Okay, yeah. And the directors from IT are here as well. They can maybe answer some more in-depth questions. But if you guys recall, there were some unanswered questions related to revenues and stuff. So when we took the approach for setting the budget for this year, we did kind of a standalone with a few little pieces that we would either add or subtract here or there. But by and large, it was a standalone budget. And we took all new requests for employees by and large and put them aside and said we would address them at the September supplement. Well, prior to that determination that we were going to go that route, the estimate of needs had been filled out. When IT filled out their estimate of needs, they had 2 part-time employees or 2 part-time positions that were funded that year for $75,000. Well, what they wanted to do was eliminate those 2 part-time positions, one of them being a web applications individual, eliminate that $75,000 and create a full-time position for a web developer, and the cost would have been $103,000. Well, we pulled that position out and didn't think to go back in and adjust for that $75,000 that we took out. IT has left that individual on at a part-time basis so far this fiscal year because they thought that they could, you know, if Budget Board decided not to fund the position, they could absorb that cost for 2 months but they need to make some decisions going forward, and it's going to be really difficult for them to wait until the September supplement. We've got Civic Plus, who is a vendor that we have had for quite some time doing our website. We've been updating the contract with them quarterly for them to help us get our website in line so that we can go fully in-house on it. The latest contractual agreement expires the beginning of September, and we still have some work left to do on that. And just for some stability with the individual that's in the position, the department, the development of the website, and other projects that IT is looking to need this individual for, we felt it was good to go ahead and move forward with that transfer now so that they can go ahead and move forward with that. As Mr. Lambert mentioned earlier, currently in reserve, we got $1.158 million in the account. With this $103,000, if it is approved, the reserve account will be $1,054,852.60, pending additions moving forward at the September supplement.
Chairman, may I ask a few questions? Dane and Rich, so you're going to have a web designer, web architect, or exactly?
Yes,
Tell
web
me.
developer.
Okay, and
Sure.
will we all have access to him?
Yes.
So,
Or her.
I'm
Him or
sorry,
her.
I didn't,
Sure.
but all of our offices
Yes.
will be able to work on our websites?
Yes,
Okay,
And
thank
in
you.
fact, a big part of this is for the assessor's office, isn't it?
correct. Yeah, we're still, that's the website that's still up at Civic Plus right now. And Mike, you'd know probably better than I do right now where we're at in that
We're in review
development
with
process.
that test set, yeah.
Yeah, so keeping in mind that that contract comes due, I believe, at the end of September, and
Yes.
yeah.
I'll motion to approve.
Any other questions?
I'll second.
Okay, all in favor, say aye.
Aye.
Thank you.
For your work on that.
Thank you.
Item 43, $64,000 for the 11th floor courthouse stairwell project. Does anybody
I have
any-
many questions
I
on
do too.
this.
On-
Would Mr. Stacy please come forward? Put your hands behind you. Sheriff? What is this?
Egress from the 11th floor. Where we're
What's on the 11th floor?
The jail where we house some prisoners when they're going to court. We have egress from the west end stairwell. The stairwell on the east end does not go all the way up. It never has. Used to have egress from an elevator. That elevator hasn't worked in quite some time, and no way really to get it back running in a cost that would be better than the one we're proposing.
How many prisoners do we house in that unit at any given time?
I think over 100 usually is when they bring them
We'll
over.
bring over from the jail to handle
So
the
100
court.
every day?
Not every day. It really varies on just the
When
dockets
court's in
and things like
session
that.
for
yeah.
one.
Okay.
And so what would this $64,000 specifically be used for?
We're going to design a new stairwell in one of a couple of locations. We're going to figure out where the best location is, and then run new stairs from 10 to 11.
And so, but this 64 would cover design?
Design only.
And manufacture, or design only?
Design only. We'll have to come back for construction once we know a construction price.
Really?
Yeah.
Are we going to have to go out to bid for an architect?
No, architect's professional services. We'll have to go out to bid for the construction.
Okay.
We're happy to give you a tour if you want to go see it, Butch.
I've actually been on that. I actually have. I can't remember if I was incarcerated at the time or if I was visiting, but I've actually been on that.
So is that a
I
normal,
believe it was an incarceration.
is that about a normal fee for designing a stairwell?
Yeah,
It's a pretty specialized design, so it's a little on the high side, but.
A lot of safety involved.
Yeah.
So,
It's
okay.
a lot of structural analysis is what you're really paying for.
Further questions?
And I assume the amount is so high because of what you said, but also because our courthouse it's an old building.
Yeah, this is going to be a very tough location
Okay.
to get a set of stairs in that
Then we
actually
can-
aren't too steep.
Okay.
And so then we can expect, well, anyway, I won't jump ahead as far as on the construction yet, but
Also, numbers such as has to do with construction, engineering, design is all going up. So when you see these numbers, last year it probably wouldn't have been this high, but numbers are higher nowadays.
Any other questions? Is there a motion?
Motion to approve.
Is there a second?
I'll second.
All in favor, say aye.
Aye.
Any citizens to appear before the Budget Board? Not hearing from anyone. Board comments. Mike? Sheriff?
No comment.
Treasurer?
I do. First, I'd like to thank those of you who reached out to myself and my family. I think probably all of you know this, maybe you don't, but anyway, I lost my sister, 75 years old. I lost my sister to COVID-19 back in the latter part of July. The reason that I want to share this with you is not looking for sympathy. My sister was a delightful person. She was stubborn, which doesn't run in our family necessarily, but anyway, she was. She refused to take the test. She contracted COVID-19, went into the hospital, got progressively worse, and we lost her after, I believe it was 9 days. I share this with you because there's no 100% guarantees in life. We know that. She very possibly, we could have lost her even had she been vaccinated. She was in that pocket in southern Missouri that unfortunately around the Springfield area where you've seen a lot of stories about the refusal to try to even take the test. Well, I can tell you on a personal basis, again, I'll say she might not have, but God, her percentages would have been so much better. She went from a 90 to 93% down to 0, and it cost her life. Please thank you and your family. I'm still dealing with that with the rest of my family. Still, a lot of them refusing to get the vaccination even after this. But I want to share this with you to again thank you for your thoughts and prayers and to let you know, please, please do everything you can to get your family members as safe as they can be. So thank you.
District 1?
Saturday, anyone is welcome to come. Saturday at 9 a.m. at the downtown post office over by the memorial. It is being dedicated in honor of Claire Looper. So Saturday at 9 a.m.
District 3? No, thank you. Court Clerk?
I'd just like to back up what Butch said. I also lost my brother-in-law, who was only 60, and he was stubborn, wouldn't take the shots. His wife wouldn't take them. They both got COVID, and it's like Butch said, he passed away. He didn't make it. He lived up in Norman, or down in Norman, but you got to take the shots, guys. We got to go ahead and take them and protect each other. So God bless each one of you, but let's protect each other.
Clerk?
On a different note, what's happening in our world, I'm from a military family, and all of my nephews have served in Afghanistan. And sadly, what's happening now is really hard on our military who fought and kept that place as stable as possible for the last 20 years. And so our thoughts and prayers go out to all the military and their families and the people in Afghanistan that are trying to flee. So God bless them all.
Is there any new business? If not, is there a motion to adjourn?
Motion.
Second.
All in favor, say aye.
Aye.
He's locking the door, there's going to be a shooting.
Oh, yeah. She has a son and a daughter, and then she has, I don't know, 6 or so.
Ma'am.
Thank you again. I do appreciate you. I've got very nice calls, and anyway, totally unexpected. And, you know, it was one of those to where, it started with, I was able to talk to her the first couple of days. But then the next thing you know, because, you know, the oxygen level. And so then she's on oxygen, so you can't talk with her, but we were able to text back and forth. And then she went to the CPAC. And so again, I was able to text, so I've still got that